Hi friends, today we will continue our conversation on the topic of the small intestine, and I will tell you how inflammation in the small intestine will affect different organs, because everybody now is talking that, oh, the small intestine is so important to overall health of our body. So it's true. It will have effect on the brain, on the eye, on gastrointestinal tract, on the pancreas, and on adrenal gland. Let's go and look a little bit deeper into that. Here on the left, you see a picture of the normal small intestine. Villi are tall, crypts are deep, and villi are lined by enterocytes. Here on the right, you can see when there is an inflammation in the small intestine. Villi are slashed, crypts are gone, and here you can see foci of inflammation. In the previous videos, I talked about that's how villi look like. And on the surface of the villi, there are different cells, enterocytes. And one type of the cells called neuroendocrine cells. Those neuroendocrine cells produce different types of hormones: serotonin, secretin, cholecystokinin, and today I'm going to talk about somatostatin. So let's see what happens when there is an inflammation in the small intestine. Villi are slashed, neuroendocrine cells are gone or drastically diminished. What effect it will have on the production of the somatostatin and the result on overall health? Now, back to the same picture. Effect on the brain. So, by the way, I want to say something. The word somatostatin has a two-part, somata and statin. And the statin translates precisely stop or decrease. So what can you expect when the somatostatin get released from the small intestine on the brain? It will inhibit production of norepinephrine, dopamine, thyroid-releasing hormone, TSH, and growth hormone. Effect on the eye will inhibit production of VEGF factor. And I will talk more a little bit about that. And clinically, what that means when you will have less of somatostatin. On gastrointestinal tract, reduce the secretion of gastrin, secretin, gastric acid or hydrochloric acid, decrease of production of motilin and SCK. On the pancreas, reduces the secretion of glucagon, insulin, and pancreatic peptide. And finally, on adrenal gland, inhibits the secretion of medullary catecholamines. Catecholamines are dopamine, epinephrine, and norepinephrine, and aldosterone. Now, let's look a little bit more into details. What will happen when there is inflammation and neuroendocrine cells are gone or drastically diminished? Here on the left, you can see effect of somatostatin under normal circumstances. So it will inhibit production of norepinephrine, dopamine, corticotropin, thyroid-releasing hormone, thyroid-stimulating hormone, and the growth hormone. When somatostatin decreased, what it will have? Increase production of norepinephrine. Clinically, it will correlate with high blood pressure. More dopamine. What's the clinical correlation? More competitive behavior, aggressive behavior, poor impulse control. What the corticotropin releasing hormone will do to our body when it's not under control? High level of cortisol. Yeah, could be bad, could be good, actually, maybe because cortisol is anti-inflammatory, right? Number 5, thyroid stimulating hormone, when it's not suppressed, will have a higher TSH, high T3, T4, and higher growth hormone. Could be bad because if person has cancer cells, and if you produce, a person will produce more growth hormone, which will stimulate cancer growth. Now, somatostatin effect on the eye is vascular endothelial growth factor. When there is no somatostatin, will increase angiogenesis and increase vascular permeability. What's the clinical correlation? Loss of eyesight and macular degenerative disease. Now, effect on digestive tract, gastrin, secretin, gastric acid, methylene, and CCK. When there is no inhibition from the somatostatin, less production of mucus, so less in the stomach. So less mucus means that hydrochloric acid that get produced will eat in the lining of the stomach. Clinical correlation is gastritis. High motility and higher production of hydrochloric acid, also higher chance to go into esophagus and create acid reflux. More bile and pancreatic enzymes, more production of hydrochloric acid. Number 4 is more methylene. So more motility, more stomach will be and digestive tract churning, higher chance of hydrochloric acid go into esophagus and create acid reflux. Next, effect on the pancreas. When there is low production of somatostatin, no inhibition, so more sugar get into the bloodstream from the liver, high level of insulin, more gastric motility, and more bile production. Finally, we are in the adrenal gland. It inhibits production of catecholamines, dopamine, epinephrine, norepinephrine, and aldosterone. When there is less somatostatin due to inflammation in the small intestine, so what we are going to have? Aggressive behavior, poor sleep, higher blood pressure, more epinephrine and norepinephrine tachycardia, and finally aldosterone, fluid retention, because more absorption of sodium, more fluid retention, clinical correlation, elevated blood pressure. By the way, this is information, you can contact me. Now, I want to go into the blackboard and talk a little bit more and explain you some details. So let's go. I decided to choose to explain you how somatostatin will affect production of thyroid hormones or T3 and T4 and the clinical correlation. So I already pre-drew my favorite picture. This is the picture of the digestive tract. This is the mouth with the teeth. This is esophagus. This is the stomach. From the stomach, it's a small intestine right here. It ends right here. It's a large intestine. Food goes here, and eventually it goes out from the rectum. Normally, hypothalamus will produce thyroid-releasing hormone, which will have stimulating effect on pituitary gland, which it produces TSH, thyroid-stimulating hormone, which will get released into the bloodstream and will affect our thyroid gland. It's located right here on the neck. And under the effect of TSH, we will produce T3 and T4, and those two hormones will affect every single cell in our body, and their stimulating effect is seen. So when we produce them, metabolism goes up. Small intestine, under normal circumstances, will have villi and neuroendocrine cells here intact. As a result, those neuroendocrine cells will produce somatostatin. Somatostatin. You remember, so by definition, statin means blocking production of effect on hypothalamus, blocking production of thyroid releasing hormones. So it means that we will produce more TRH. It also will have effect on pituitary gland, also will decrease production of TSH. As a result, net effect, we will decrease production of T3 and we will have decreased production of T4. When there is an inflammation in the small intestine, somatostatin produce less or not produce. As a result, there is no inhibitory effect on pituitary. There is no inhibitory effect on TSH. So we will produce more of this, more of that. As a result, we will produce more T3 and more T4. As a result, person may have hyperthyroidism. Okay, so I hope, guys, it's clear for you how somatostatin affect our organs. I want to say a few words on the topic, that if it's only was that easy, that somatostatin block the production of TSH or T3 and T4. In real life, it never works like that. Our body has numerous control mechanisms, not numerous, but many. Good example comes into my mind. Many years ago, I took a train in Norway into fjord, and train was a straight drop down. When we boarded the train, mechanic announced that, he said, people, please do not worry. We are not going to crash. Train has not one, not two, 7 brakes. Even if 6 go out of business, the brake number 7 still will bring us down safely. The same could be said about our body. Body has numerous control mechanisms, not 1, not 2, 3. Otherwise, we will just produce a T3 or T4 out of control, or it will be just blocked. The same could be said about blood pressure. Yes, somatostatin has effect on epinephrine, norepinephrine, but it's not that it's only hormones that controls our blood pressure. There are other mechanisms that control it. But what I want to make sure that you understand how one hormone can affect, a hormone from the digestive tract can affect overall health. And when you are thinking about the person or patient, you have to look not only, oh, this person has an elevated blood pressure and give him a medication. Need to look deeper. Is there something going on in the small intestine? And maybe it's a good idea to fix it. Okay, thank you very much. Like, subscribe. Bye-bye for now. And all relevant information in the description below. Bye-bye.